Good afternoon, everybody. Good morning, if you're in New York. Welcome to our Rethinking Democracy in an Age of Pandemic series and to this workshop on marginalised groups. My name is Jane Ohlmeyer and I'm the director of the Trinity Long Room Hub, our research institute in the arts and humanities here in Dublin. And I'm delighted to be co-hosting this event with my counterpart in New York, Professor Eileen Galouli, who's the director of the Society of Fellows and Higgins Center for the Humanities at Columbia. It's always a pleasure to welcome you, those of you who are our Zoom attendees. So colleagues in the Zoom room come from Trinity, Columbia, the universities of Sao Paulo, Virginia, Białystok, Utrecht, JNU and Ambedkar in Delhi and further afield as well. We're joined by journalists, authors, arts practitioners, as well as representatives from the world of policymaking, enterprise, civic society and cultural organisations. We're also delighted to welcome those of you who are tuning in on Facebook and especially using the Irish Central platform. It's lovely to be partnering with Irish Central today. So this is the second of a special 5-part workshop series organised by the Hub and the Heyman in response to COVID-19. If you missed the first workshop on nations and borders, it's available as a podcast on the Trinity Long Room Hub and website and the Heyman website. Our workshop series has been developed out of a longer partnership between the two institutions, including an 18-month Global Humanities Institute on the crisis of democracy that actually had been funded through the consortium of humanities centres and institutes by the Mellon Foundation. And more recently, the Hub, the Heyman and a wider consortium have also got together to apply for further funding on participatory and deliberative democracy. That grouping is called Isagoria, and it's lovely that some of our Isagoria partners are with us today. This is our second workshop, as I said. Now, last week we had a few technical issues, or I had a few technical issues. Hopefully the Wi-Fi will behave itself this afternoon, but if it doesn't, we'll carry on regardless. And my deep thanks to Eileen Galouli for taking over last week when my Wi-Fi crashed. Let me just say a quick word about the topic and the importance of running this series of workshops on rethinking democracy. Life as we know it has changed in a matter of weeks, and this series asks, what does COVID-19 mean for democracy in the world today? This morning, we want to focus on what it means for those on the margins of our society, these people who are often the most vulnerable to the virus. We need to understand what the pandemic might mean for these populations, both in the short term and in the longer term, and what consequences this has for democracy. And as we all think about what the post-COVID-19 world might look like, we need to consider how this can be an opportunity to change attitudes, to implement reform and build better and more inclusive societies, to hit the reset button on the world and make the world a place that we all want to live in. Now, our format today, we've tweaked it a little bit since last week. We still have 3 speakers, but we're actually going to have a panel discussion with 3 speakers rather than 2 speakers and a moderator. And we've invited each of our speakers to talk for up to 9 minutes. And then it's going to be over to you, the participants in the Zoom room and our audience on Facebook. And we really do want you to participate. If you're in the Zoom room, you can join the conversation in 2 ways. Firstly, you could raise your digital hand. That's a feature in Zoom. If you click on the icon labeled participants and then click the raise hand button, it should allow you to raise your hand, and then I will call on you and you'll be unmuted at that point. So we'll actually unmute you. There won't be any video. The other way you can submit your questions is through the discussion and using the Q&A function on your screen, and then I'll read your question out for you. But we really want to try and make this as interactive as possible, so please do keep those questions coming. If you're on Facebook, please post your questions in the comments and we'll be collecting those again. We'll read them out on your behalf. It's lovely if you say something about who you are and where you are, as well as asking a question. We're also aware we've lots of experts in the Zoom room, and again, if technology allows, we might try and call on you as appropriate. If this happens, Francesca will invite you to unmute yourself, and if it's a longer discussion, we'll bring you onto the virtual panel. As usual, we want everybody to engage in social media, so please tweet using the handles @TLRHub and @SOF_Heyman. So we'll put those in the chat function so you can see, or so again, just to remind you, it's @TLRHub and @SOF_Heyman, and use the hashtag #HubMatters. Now to our three fabulous speakers this afternoon, and I'm so grateful to all three of them for taking time out at such a busy moment. Our first speaker this afternoon is Professor Rosemary Byrne, who is Professor of Legal Studies at NYU Abu Dhabi, formerly of Trinity. Rosemary was very involved in our Global Humanities Institute on the crisis of democracy. She has served as a Human Rights Commissioner for the Irish Human Rights Commission, which was established in the aftermath of the Good Friday Agreement, and was chair of the Scientific Committee of the EU Fundamental Rights Agency. So Rosemary, thank you very much indeed for agreeing to be part of our panel. I'm going to introduce our other two panelists, but we will start with Rosemary in just a second. Our second speaker this afternoon is Professor Roseanne Kenny. Roseanne is the Chair of Medical Gerontology at Trinity. She's just been awarded an Irish Research Council and Health Research Board grant to explore the impact of COVID-19 policies on mental and physical health of older adults. Congratulations, Roseanne. She's also the founder and director of the MISA, a large clinical research institute for aging at St James's Hospital in Dublin, and the founding principal investigator of the Irish Longitudinal Study on Aging, which we know as TILDA. So again, Roseanne, thank you very much for being with us today. Our third speaker is Professor Vincent Schiraldi, who is a senior research scientist at the Columbia School of Social Work and co-director of the Columbia Justice Lab. Vinny founded the Justice Policy Institute think tank and was formerly the commissioner of the New York City Department of Probation and senior policy advisor to the New York City Mayor's Office of Criminal Justice. So we really are, again, delighted, Vinny, that you're with us. So thanks to our panelists, and maybe without further ado, if we could turn to Rosemary Byrne. So Rosemary, over to you, please.
Thank you, and thank you, Jane, for the warm welcome. This is the first virtual seminar that I've done, and I've been warned by colleagues that you can't really speak with your hands, which for me is a real challenge, but I'll do my best and will apologize in advance if my waving hands disrupt people's screens. But I'm really pleased to be actually talking about marginalization in the context of COVID, because if you think about the impact that the virus has had, the main voices within my field, within human rights, have really focused on what the implications are for marginalized communities. So if you look at the first main statement coming out from Filippo Grandi and Michelle Bachelet, the UN High Commissioner for Refugees and Human Rights, respectively, they came out with a really powerful joint statement. And their focus was on those individuals that are, quote, far from the levers of political power. And I think, Jane, you really flagged this when you started the discussion, is that what we're talking about are individuals whose lived experience is very far from being incorporated or driving political choices. And so, COVID has not only affected them, but it's brought them into the kind of our radar in a very different way. And I think when Bachelet and Grandi issued this statement to the international community, They made a comment that I think is very common whenever there's a crisis that affects rights, is that the virus will undoubtedly test our principles, our values, and shared humanity. And most crises do test those kinds of fundamental areas of the human experience. And usually what happens is you have a call for solidarity, whether it be moral, political, or social, sometimes legal, where you look at what your duties are towards others. But by and large, even when you have it within, say, a highly developed regional governance system that comparatively, although it's weak, the European Union is, solidarity is weakly defined, it has a short shelf life, and it's often very disappointing when translated into real hard commitments by states. So in a way, we have this sort of antiquated approach to the whole issue of COVID and marginalized communities, but it's also being superseded by another message. And that's what I want to explore, what it is that's distinctive. Because I think the common response when you look at the experience of COVID on marginalized communities is precisely what Alexandria Ocasio-Cortez mentioned just this week when back in her own community in the Bronx, is she observed that the crisis isn't really creating new problems, it's just pouring gasoline on our existing ones. And the problems of marginalized communities seem eternal, whether they're on the grassroots or global levels. You have problems around homelessness. You've got 1.8 billion people in the world that are not adequately sheltered, both emergency shelters, informal settlements, all that have problems related to gross overcrowding and absence of access to water and sanitation. Long before the virus became a pandemic, UNICEF and the World Health Organization were reminding states that 3 billion people lack basic access to hand washing facilities. And then there's just the general economic deprivation that we see more acutely now. But there are 4 billion people in the world as we sort of spiral into this economic crisis that don't have basic social protections. So what is striking, and why I'm speaking, what we all see on our various national and grassroots local levels is the scale on a global level of the challenges that affect marginalized populations. But in thinking about really sort of marginalization and going back to the idea that it's sort of just exacerbating existing problems, I mean, it's certainly clear that the pandemic itself is highlighting what we choose generally to ignore. I think, you know, there was an event this week that was very telling, that in Geneva, a city that one associates with expensive watches and luxury, had literally a line a kilometer long with 2,200 people lining up, waiting 3 hours to receive a small bag of food worth 19 euros. And the population referred to in Geneva as the invisible, the invisibles, certainly was far from that. But it shows that indeed there are areas or pockets of our communities that are ignored or that we choose not to see. I think another kind of phenomenon that's come out that again is a worsening of what already exists are these attacks with respect to xenophobic attacks, scapegoating of people, of others within our community. So you've got, you know, Chinese and other Asians being attacked, hate speech in Europe against the Roma. You have hate speech likewise in North America against Hispanics, Muslims in India, East African and Asians in the Middle East. It just goes on. There's a very interesting article by Jedwab and his colleagues that looks at this whole kind of link between pandemics and the kind of strategic space that it opens for persecuting other groups, and goes way back to the 14th century, looking at the treatment of the Jews during the Black Death. So while it's hardly anything new, we're certainly seeing that COVID has given really a ripe opportunity for this to gain ground. It's also, and I think interestingly, calling out our hypocrisies and the celebration and recognition of what is nothing short than heroic contribution on the front lines is increasingly being countered, or not countered, but perhaps conditioned by those frontline workers who see their role as quite as essential workers as really being in many ways forced, as it is essential to work, given the social precarity of the kinds of jobs that carers and those that provide various support services within our communities offer. And you see just today, Sujatha Gilda, writing in the New York Times, qualifies the fact, indeed, saying she is a conductor on the subways, saying we're not essential workers, but in light of the deaths of those amongst her colleagues, were sacrificial workers. So I think while, the realities in society of those of illegals, those without papers, of individuals who are victims of xenophobic attacks or who are in precarious jobs, and the widespread hypocrisy that accompanies the way that we discuss these issues, all are not really particularly new, but they're manifesting themselves in a distinctive way, which is why I think to sort of come to grips with the implications of COVID, I think it's important to look a bit more closely at the nature of the pandemic and the forces that have really unleashed its spread. And so I just want you to kind of hang with me for just a minute as I think about the pandemic as really being part of these broader forces of globalization, departing from issues, that a human rights lawyer speaks about, the right to life, what you need to support that right, shelter, access to quality health care, testing, social protection, sick leave, all of those basic tangible issues. And I want to step back and think about COVID as part of these broader forces of globalization, that it's transmitted with accelerated speed, as we've all witnessed, in just a matter of weeks across borders. It accentuates in many ways the deep fault lines in society that we're already well familiar with. And the last point that I think is really critical with COVID is it heightens our interconnectedness. And it heightens it in a way that is both lethal, and I'll argue, I think, in the final few minutes, and perhaps promising in terms of the kinds of reforms that it might bring. And I want to sort of highlight that interconnectedness in and of itself is, that's commonplace. We can think about pressing environmental issues as being yet another example. But the international environmental challenges or threats are really of a different nature compared to the intensity and the speed with which COVID is being transmitted and challenging our societies in a very fundamental way. So when we talk about solidarity, and the way that I began this talk within the kind of human rights sense that we owe obligations as we're all sort of part of the human family, this is a very different kind of solidarity. I prefer to think of it as kind of a survival solidarity. It's imposed upon us. Because if you look at the response, and I think this brings us back to what really struck me with the approach of Bachelet and Grandi when they were speaking for the first time in a powerful joint voice about COVID and the challenges that it poses for those in marginalized communities. And it said that with our response to this epidemic, it has to encompass and in fact focus on those whom society often neglects and relegates to a lesser status. Otherwise, it will fail. And I think it's that last point that is really critical when you think about the relationship of COVID to what's happening in the world, that there is an urgency to actually engage in a different way with the challenges and issues that we have conveniently ignored, or perhaps with a bit of discomfort, but nonetheless package and engage with the hypocrisy that has been really sort of unveiled and exposed as this crisis has unfolded. So just to wind up, what I think this might mean in an optimistic, perhaps a bit unrealistic, as most of what we aspire for when you work in human rights might be realized in increments, but rarely in its entirety. But in a best case scenario, Does urgency require a raising of the floor of social and economic rights beyond the obligation perhaps felt by some to raise wages and have better protection for those frontline workers, because we all benefit indirectly from that? But what about housing for migrants? Think about the risk of contamination, or those in institutionalized facilities, and the need to actually raise standards if you want to be able to provide a genuine environment where social distancing, which at this stage is one of the main routes to controlling the pandemic, well, then you're going to have to see different kinds of guidelines. And you've already seen in Bahrain, in the Gulf, you see the introduction of legislation that is requiring that housing allow for 3 meters distance between inhabitants. Something that has already been codified in the law. And I think we might, in an optimistic way, not see a huge sort of reform of economic and social policies, but we may actually see that in the area of housing, in the area of sanitation, and I think one could also say, and one could hope, in access to health, the quality of public health services, access to medication and equipment, all of these kinds of issues, we may see incremental improvements simply because when we now talk about solidarity, we're no longer calling on people to rise to the moral occasion, but rather what we're calling upon them to do is to act in a way that is prudent, and indeed their survival may depend on it. Thank you.
Thank you very much, Rosemary. That was absolutely fabulous, and a lot of very profound insights there. And you end on quite a hopeful note, so a lot to think about. If we could turn now to Roseanne Kenny. Please, Roseanne, over to you.
Thank you very much, and thank you, Rosemary. You've set the scene beautifully for what I'm going to speak to, which is how the pandemic has affected older persons globally. And I just want to say to the audience that this is pertinent to you. The one certain thing is that you will be part of this cohort. And if you're not, you won't be around to know about it. So this is relevant to everyone listening. Since the mid-1800s, we've been living year on year longer, such that each decade, that cohort lives on average 2.5 years longer. And it looks like that trajectory is going to continue into the near future, despite diabetes and obesity, etc. So bear that in mind. This is pertinent to you. The demography is changing dramatically. Already we have seen the number of people globally over the age of 65 outstrip those under the age of 5. And I want to kind of reflect in the context of marginalization on when we first got some signals that this was important for the older persons, and then when we started to maybe pay even slight attention to those warning signals. And way back in early January, there was a detailed report from the Chinese Center of Disease Control, and it clearly highlighted that older age was the most significant risk factor for severe complications and death from COVID. Now, at that stage, of course, COVID was in its infancy in Europe, in the US, and in Canada. Roll on to the end of March, for example, in Spain, and I'm going to give you a couple of case scenarios to set the context of how we have addressed marginalization in our older citizens. End of March, the army were called in to a nursing home in Madrid to disinfect the nursing home. And there they found abandoned dead bodies in beds of residents. Many of you will recall this atrocious circumstance. Now, this was home for these residents. Some had been there for 6 years and longer. So that was Madrid. That was end of March, 3 months after we got the first signals from the Chinese. In late April in Montreal, again, authorities were called in to a residence where they found residents, patients, left soiled, unfed, dehydrated. there had been 31 deaths there in the previous 2 to 3 weeks, and the caregivers had fled. They were frightened, they were overwhelmed by work, they had left the residence. Another atrocious example in this day and age of attitudes towards that particular sector. It took until the 29th of April in the US for official systematic recording of deaths in the nursing home sector. Globally, somewhere in the region of 45 to 60% of all deaths in relation to COVID have been in the nursing home sector. And in Ireland, our figure is 54% at the moment. The US isn't the only country which hadn't actually documented COVID deaths in the nursing home sector from get-go. This was the case also in the UK and in Ireland and in many European countries. The LSE wrote recently that reporting of deaths in England are inadequate and likely to give false assurance that numbers are significantly lower than reality. And we can ask ourselves, why? Why was it deemed acceptable that that particular cohort should not be documented with respect to the pandemic? To take a step back and try and understand, why do people go into nursing homes? Why will we maybe go into a nursing home someday or require that level of care? 4 to 5% of people over 65 in the US and in Ireland and in many other countries are in a nursing home sector or a significant assisted care home sector requiring significant care. That's 1.5 million people in the US and almost 30,000 people in Ireland, the Republic of Ireland. And the reasons are that people acquire multiple comorbidities, either physical or mental. So diseases such as heart disease, dementia, of course, strokes, falls, fractures, and those diseases or disorders disable people, so that generally speaking, residents in nursing homes aren't able to maybe prepare meals, or in some cases eat independently, feed themselves independently, bath, dress, toilet, manage medications, or mobilize without assistance. That's why people require that level of care. It's really unusual for someone to volunteer or to request to go into a nursing home care. And in 35 years of clinical practice in medical gerontology, I've had 2 patients who requested to go into a nursing home who I didn't think required that level of care, but they were lonely and perceived that they required that level of social engagement. Very unusual. So because of the complex comorbidities, these are a skilled nursing workforce, or certainly healthcare workforce, and yet they're probably the worst paid in our healthcare system, and certainly one of the least valued. And that was unmasked by this pandemic, where lowly paid healthcare workers had opportunities to get better pay elsewhere, like in supermarkets. And that was one of the issues in Ireland, that many actually moved into other sectors for better resource when they could. Why did we get this issue? Well, first of all, the infrastructure in many of the facilities wasn't appropriate for infection control, and there was no planning in advance, many months in advance, as there was in the acute care sector, to ensure that there was appropriate infection control. So without rigorous infection control, you had in many cases migrant workers who were living in clusters, coming into the nursing home, maybe infected with COVID. No screening was taking place on time, no proper PPE, etc. Patients much iller, requiring more intensive nursing care skills, which weren't available. Many of these homes are in the private sector, so there wasn't absolute clear clinical governance. It was happening on a wide scale. And once screening started, then it became apparent who was and wasn't infected, or who had been in contact. That further significantly reduced staff numbers. And of course, the reduction in staff numbers, even in contacts, meant that it was very difficult to look after now iller patients. So it was a catastrophe awaiting to happen. And as Rosemary has said, it really unmasked the fragility of this whole sector. It was borderline to begin with. So that was coupled then with lockdown. So the solution was, we'll lock everything down. And bar relatives, siblings, spouses, often older themselves, children, etc., from visiting. And this has been the case now for over 8 weeks in some nursing home facilities. And some of the residents are not fluent with technology. We're using technology for today, but many of these residents are not fluent. So they're dependent on care staff for short windows of opportunity to engage with their loved ones. And that's very hard pressed, busy, overstretched care staff. So that doesn't often happen. And then that's compounded by guilt, anguish, and worry, which is felt by their loved ones, and poor communication, because when you're really busy, you don't have time to answer the phone all of the times and engage and communicate. So the hard-pressed staff have not been able to rise to the challenge of this very fragile infrastructure. Monique Pelletier, who's a former Minister for Women, I think put it really well in a recent op-ed in Le Monde, where she criticised the incomprehensible and inhumane way that residents in some retreat homes were being treated. It's taken hundreds of deaths in France for persons who have died from COVID in these establishments before people in France woke up to show some interest in those rest homes. So our constitution is very clear. We're held equal before the law. This means that the state cannot unjustly, unreasonably, or arbitrarily discriminate between citizens. We can't be treated as inferior or superior based on ethnicity, race, social, and religious backgrounds. The Constitution specifically recognizes the right to life. Your right to life means the right to have nature take its course and to die a natural death, but it does not mean the right to have life terminated or death accelerated. So why has this happened? Why have we enabled this in our society? And I put it to you that we're very ageist and we're fearful ourselves of aging. And because of our fear, we block out the possibility that I started with. We're all going, this is going to happen to everybody. This is our responsibility for ourselves. Ageism is stereotypes, prejudices, discrimination towards people based on age. It's the commonest ism. 1 in 3 people in Europe experience ageism. And we see it all the time in cultural, in our institutions, on a personal level, etc. And the problem is, and this has happened with this pandemic, people and our children in our society will internalize ageism. They'll internalize negative perceptions of what has happened through media, etc. And we know from a research perspective, that actually shortens our lifespan by 7 years. If you have negative perceptions of how you're aging, you will live 7 years less than a person who's got a positive attitude to aging and positive perceptions of how they age. However, I too want to end on a more positive note, because I think this has unmasked ageism at society and at policy level and indeed within individuals, and particularly within our media. But this was previously an invisible sector, and it was really hard to get visibility in this sector. We now have an opportunity for change. This pandemic, it's very likely we will experience more, and this is the cohort, and as other marginalized groups are, who will most be subject to severe consequences from these. So we need more research to identify what's the best policy and practice for individual countries. We need much better education across all sectors. Our education and training with respect to aging is poor in our third level institutions. And this is an opportunity now to reflect on that. And to ensure that the rights of citizens to feel equal in our society are met, whatever their needs. And I was very glad to end on a note, even more positive note, that the Taoiseach, who is himself a medical physician and who's doing a session a week on the front line, stated on Friday night that we will review our entire care sector from housing through to nursing home care and our policy with respect to the ageing sector in Ireland. And that's very welcome. And frankly, it can't come quickly enough. Thank you.
Thank you, Roseanne. I mean, absolutely, what a compelling case study you've given us there. And as you say, maybe there is a silver lining, and that's something that obviously we want to hold our government to account. But on a very personal note, the reason I'm here in Donegal is I'm cocooning, and even that language is problematic. My 85-year-old mother, she was so delighted today she could actually get in her car and drive to the podiatrist. You know, that was, she hadn't been out of the, you know, from our immediate neighborhood for 2 months. You know, she came back full of the joys of the countryside, and you know, it's, as you say, it's our story. It's our, we have to take ownership. So thank you very, very much indeed. If we could turn now to our third speaker, Vinny, over to you. I think for another extraordinary moving case study, but please, the floor is yours.
Thank you. Those were really two powerful presentations, and I'm honored to be on with you all. Are you hearing me okay? Good. So I'm going to talk about probation and parole in the face of the COVID epidemic. But I'm going to try to make 3 different points during the course of what I'm saying. One is just to talk about incarceration, prisons and jails as a uniquely bad place for both infection and also the spread of the virus back out into communities. Go into a little about probation and parole as a sort of understudied, under philanthropized, under advocated portion of the system, even though it's the biggest portion of the system. And I feel like that we ignore it at our peril. And then finally talk about the mixture of all of that with the current pandemic. So just started a little about prisons and jails first, and I'm going to do this through a U.S. lens, although I'll try to be a little international here and there. But I used to run youth corrections in Washington, D.C. I inherited a very awful youth correctional facility. It was just, you know, this is in the nation's capital. It had been under litigation with some of the nation's leading litigators for 19 years. And the kids used to take their shirts off at night and stuff them in the cracks in the floor to keep the rats and cockroaches from crawling up on them and biting them at night. They slept in dormitory settings. Everything they did in group settings. The place was just disgusting in terms of sanitization. And I cannot imagine if a virus like this had appeared suddenly, that my staff was going to be able to keep the place clean. It's just preposterous to believe that these sorts of habits that have been formed around our correctional facilities in the US, where we're fully willing to denigrate and humiliate incarcerated people, are going to change overnight because of a virus. We're not going to keep these places clean. They're places of forced proximity, the opposite of physical and social distancing. The people in them are medically vulnerable. They're very often underinsured, have asthma. Kids, tons of the kids in my facility had asthma, which exacerbates the symptoms of COVID-19. Heart conditions, diabetes are all well documented higher in the populations that are incarcerated in America, and they are wildly disproportionately people of color in them who are disproportionately suffering from COVID in communities. There's been a couple of very good pieces of research that have been published in the US, many by newspapers. So the New York Times has shown that initially the Cook County jail, which Cook County's Chicago, was one of the leading fomenters of the virus. That's subsequently was replaced by the Marion County, by the Marion Penitentiary in Ohio, which they found to be the leading hotspot in the United States for COVID. Almost 80% of the people incarcerated in that prison were tested positive, and it was connected up to 1 out of 5 cases of positive COVID in the state of Ohio. So point number 1, jails plus COVID equals bad. So point number 2 now, probation and parole. I'm going to give a little history on probation and parole. And this is where the United States and Ireland's history overlaps a little bit. Probation and parole in the U.S. context came to be in the mid to late 1800s. In the case of parole, it's thought to have initiated in Australia, traveled to Ireland, where it became a national system under Sir Walter Crofton, the Irish system it was called. And then one of the rare cases of research actually influencing correctional practice, a paper was presented in 1870, an influential paper at the inaugural conference of the National Prison Association, which is now the American Correctional Association, touting the Irish system, and then got adopted a few years later at Elmira Penitentiary, which is thought to have had the first parole system in the country. Initially, by the way, when the paper was discussed, some of the people at the conference pushed back and said, why should people be supervised after they get out of prison? They've served their time. We should leave them be. And Crofton responded and said, well, it shouldn't be about incarcerating people. It shouldn't be about supervising them. They should be able to pick a next friend who is sort of a mentor and helper when they come out of corrections. So I think that at least initially, arguably, there's certainly points of view on both sides, but arguably initially, both probation and parole were meant as a helping function. They were a reaction to the punitive nature of both things like the stocks and pillory, and later the penitentiary system, which fairly quickly was abusive. And probation and parole were thought to be ways to sort of move people away from those systems and into something that would be arguably at least partially helpful. That rehabilitative ethic hung on from the mid to late 1800s all the way in the U.S. to the 1970s, when there was a real pivot in U.S. Penal policies towards just deserts, punishment, deterrence, incapacitation, and away from rehabilitation. Part of that wrapped itself in the Southern strategy to racialize poverty issues and racialize crime and justice issues in ways that they hadn't been prior to then. And part of that was some weak research that just concluded that nothing works when it comes to rehabilitating people that have run afoul of the law. Both of those things hit at the same time and flourished, and the notions of rehabilitation really died in American criminal justice in the 1970s. So it was one thing for the prison system to lose those concepts of rehabilitation. They weren't really doing all that much to help people turn their lives around in prison anyway, and they could quickly adopt incapacitation and punishment and deterrence as their goals. Probation and parole had a little harder time because they were, if nothing else, they were all about rehabilitation, or at least purportedly. So they had to pivot, and pivot they did. Became much more punitive, much more surveillance focused. They started to cling to notions of intensive supervision probation that would mete out intermediate sanctions, electronic monitoring, house arrest. And so they started to sort of wear the armamentarium of their big brother, the prison, and mushroomed inside right alongside the growth of incarceration in the US. There's about a 5-fold growth in the prison rate in the US and about a 4-fold growth in probation and parole. And so if you think about it, there should be an inverse relationship. If probation and parole are meant to be release valves or alternatives to incarceration, the more probation and parole you have, the less incarceration you should have. So they really started to become more of an add-on and a tripwire back to incarceration. So we get to now, the current state of affairs is that there are 4.5 million people on probation and parole. That's twice as many people as are incarcerated in the US, more people than live in most states, and almost as many people as live in Ireland. The 45% in a recent research by the Council of State Governments, 45% of people in our prisons were on probation or parole when they got locked up. A quarter of the people in our prisons, and this is the biggest prison system in the world, quarter of the people in it are in not for committing a new crime, but for some technical violation of probation and parole, like missing appointments or testing dirty for drug use or the like. So message number 2 is that even before the pandemic, this largest part of the system wasn't functioning particularly well, certainly wasn't rehabilitating and diverting people from incarceration, and had grown far beyond its ability to function properly, and became a feeder system to incarceration. Interestingly, by the way, I lived through a lot of this. I got into this field in 1980, so a lot of the history of mass incarceration, sort of corresponded with my time in the field. And I think there was a real animus to the growth of prison and jail in the United States. People were leaning into that. Politicians were building prisons with fervor and energy. Not so much with probation and parole, by the way. I think when you tell most elected officials in the US, and I've had plenty of conversations with them, they don't even know how big probation is. They know almost nothing about probation and parole. I think it's grown more like a weed in the yard. It's been untended and unattended to. And so now the third point, which is to sort of combine the probation and parole, community corrections, if you will, with the moment of the pandemic. And there's a really interesting article by Beth Schwartzapfel in today's Marshall Project. I encourage you all to check out. And she starts with the case of a woman named Tammy Lewis, who's in prison in Texas. And she's made parole. She's gone to the parole board. The parole board said, you can be released. But before you can be released, you have to take a 6-month drunk driving program. She must have been locked up for drunk driving. She was already on the wait list for that program before the pandemic occurred. She's not being released. She's still locked up. And then, of course, once the pandemic hit, the class got canceled. She's now taking it, by the way, by paper. But, it's a correspondence course. Why she can't do that from her home, why she has to sit in prison to take a correspondence course on drunk driving, I don't know. And lest you think that Ms. Lewis's case is an isolated example, there are 15,000 people in Texas's prisons who have been granted parole and are waiting to complete some program or the other before they can be released from prison. That's about 4 to 5 times the size of the Irish entire prison population. Flash over to New York. New York incarcerates the second highest number of people in the country, New York State, for technical parole violations. It's about 5,000 people in right now. About 7,000 people come in every year. Again, double the size of the Irish prison population. Comes into New York prisons every year just for technicals, not for new offenses. In Rikers Island, where people wait in jail, that's the local jail, they wait to have their hearings before they go to state prison. 1 out of 6 people jailed in that notorious jail were just awaiting their hearings. And the first 2 people to die from COVID in Rikers Island, Michael Tyson and Raymond Rivera, both over the age of 50, both had comorbidities. Michael was up for missing appointments. Raymond was up for failing a drug program, not new crimes for either one of them. And they were the first two people to die in Rikers of COVID-19. Pretty likely that they caught it while they were incarcerated. It's hard to know exactly, but they both came in at a time before the virus had really hit New York and were incarcerated waiting their hearings through that time until they died. So sorry to be the bearer of a great deal of miserable news. I'll try to end with some good news. One is that there's been a unusual voice of probation and parole commissioners like I was. I ran New York City probation, but now there's been 50 plus probation and parole commissioners early on in March who issued a statement arguing that we should stop technically violating people. We should stop having people come into office visits where they're going to sit in rooms for hours waiting to answer the same 5 stupid questions that their parole officer asked them last week. We should stop doing that so that they don't sit in rooms and infect each other and infect parole staff. We should stop charging them fees, and we should release people that we've locked up for technical violations. And that's, a lot of those 50 people are current probation and parole commissioners. So for them to sign their names to that is not unimportant. And then an American Probation and Parole Association survey of departments around the country showed that of the 300 plus departments that responded, 3/4 had stopped technically violating people and had stopped having office visits. The jail populations in the US have declined. These are idiosyncratic data. We don't have real hard studies on it yet, but in the first month, there have been a pretty substantial jail population declines. That's jails in the US are mostly pretrial or very short sentences. Hasn't filtered up to prison populations yet. So for example, in New York, there's been a 38% decline in the population of Rikers Island. But the state prison population, which is a different entity, runs it, is about the same as it was prior to the virus. So in conclusion, we all want to go back to normal. I'd love the kids to be going back to school. I'd like to be able to go to a bar and go to restaurants and movies. The corrections field is a space, both in terms of jails and prisons and in terms of probation and parole in the United States, where we do not want it to go back to normal. Normal was terrible. Normal, by the way, for lots and lots of people, particularly people of color in the United States, was already a nightmare, was already an emergency. Now it's just an emergency to all the rest of us. But for people of color, it was a daily emergency. And we need to use this as a moment, hopefully a watershed moment, where we can take a real hard look about whether technically violating anybody, frankly, not just 1/4 of the prison population, but really anybody, is associated with public safety or rehabilitation. The research I've seen is that it is not. Whether parole and probation supervision are needed at this level, or in some respects, whether they're needed at all. They started out as a helping function. They started out as a volunteer function. They started out as a more community-based function. Maybe communities should just support people when they come out of prisons with no tether back to incarceration. And maybe the billions of dollars we spend locking people back up should be used to support them in terms of their employment, their mental health, their housing, and other supports that would help them thrive when they come back to their home communities. Thank you.
Thank you very much, Vinny, for another absolutely fascinating presentation. So our 3 panelists, boy, that was fabulous. Lots of questions are coming in. So I'm going to try and group the questions a little bit. So the first 2 that I've got are, Roseanne, more geared towards you, but both Vinny and Rosemary should feel very free to come in and, get stuck in too. So the first question I have is from Mo Flynn. Mo, I'm not sure where you are, but thank you for your question. It is, given the global issues arising in relation to older people and deaths in long-term care, is this not the time to address the model of care itself? We seem to have globally over many years come to the belief that congregated care in large settings is appropriate, but we can't ignore the significant commercial investment in the sector, which drives the employment model, the care approach, and the lack of clinical therapeutic involvement. So in other words, it's time for a fundamental reconfiguring of the care model. So that's one question, Roseanne. And there's another related one, which comes from Declan Ledden, who's joining us on Facebook. He's a policy advisor and Trinity undergraduate. He says, I was on a call this week with Helen Clark, former New Zealand Prime Minister. She said that more investment in the human rights of older people is crucial, given that this crisis is a long-term one. Does Professor Kenny feel that there are specific recommendations that the Irish government could fast track? So Roseanne, would you start with those two? And then, as I say, Vinny and Rosemary may want to come in, but I've got lots of other questions that people want to ask. So Roseanne, over to you.
Thank you. Yes, great questions. Thank you, Mo, and thank you, Declan. We need a complete multi-sectoral review of our approach to aging generally. I would say that in the first instance, and particularly within the healthcare sector, but not exclusively. I was involved in the science, the SAPIA report, which was launched late 2019. SAPIA is a science advisory group in Europe composed of academics to advise policy. That's actually a fresh policy document that I could point listeners towards, which actually embraces the spectrum of aging and how Europe should approach aging. And one of the excellent chapters that's there is on aging in place, the evidence for benefits of aging in place for the individual, for society, but also the cost benefits of aging in place. And it's always assumed it's much cheaper to run institutional care for people with complex needs than aging in place. We've seen in the mental health disability sector that this is actually not the case, and they have championed aging in place, and there's reason. Well, and there are other models actually elsewhere in Europe where aging in place works very well. So the first principle I would say is aging in place and how we enable aging in place. But secondly, to do that, we have to have adequately trained and valued care staff to deliver aging in place. And this is something that requires scaling up very quickly. There are, if I take medicine, for example, many universities do have a faculty for geriatric medicine, despite the fact that 70% of inpatients are over the age of 65 in the acute hospital sector, for example. And there's little paid to aging in multiple specialties that you have thought, like pharmacy, radiotherapy, etc. You'd have thought, well, there must be there is not a large section devoted to that, or dedication to training. And many of these subspecialties in medicine, cancer therapy, respiratory therapy, cardiovascular therapy.
You know, we're losing you, Roseanne. So we've just lost audio there. So thank you for answering those questions. I realize you've got more to say, but I'm actually going to move on just simply because we've lost the audio. We'll try and get Roseanne Kenny back. So I've got a question here specifically for Rosemary. Or maybe Rosemary would like to start with, and then we can again open it up to others. So it's from Ahuvia Kahan, who's a professor of classics in Trinity. And it says, without doubt, COVID-19 highlights our interconnectedness, but interconnectedness is sometimes the instrument of inequality. In an interconnected world, powerful multinationals can have better access to low-wage labour markets. Political and economic elites can act more quickly and effectively to control those who lack such privilege. How can we ensure that we preserve the equity and equality of our new interconnected world? Great question, Olivia. Do you want to start, Rosemary? And then Vinny, you might want to come in on this one as well.
Let me just unmute.
Yeah.
It's a complicated question, and I think a really good one, and gets to really the core of global inequalities, and also I think tags into lots of debates about globalization and the winners and the losers. I think what is important, and that I didn't really address in the intervention, is that when we're talking about reforms that are needed in order to respond adequately to COVID, it also involves private actors and multinational corporations that up until now, they might be acting in certain ways, whether they have supplier codes of conduct in terms of how they engage with their workers, might be but one example, but the ways in which they engage might be motivated more by reputational risk because their equations or their justifications for how they operate are very different from when you're coming at these issues from a rights-based perspective. So I think to a certain extent, COVID will open up opportunities for discussions, not only between states and civil society in terms of how to respond, but also in terms of the broader issue of business and human rights, because those really are the big actors out there. We're talking about the absence of social protections, the precarity of individuals, and the current economic crisis as the fallout from COVID. I mean, businesses are really the central and core actors. I hope, to be honest, part of the question froze, so I hope that I answered, wasn't completely off point, but.
Thanks, Rosemary. I don't know if Vinny or Roseanne, it's great to have you back. If you want to get in, or will we move on to the next question? Okay, maybe we'll move on. This one is from Sophie van der Volk, and Sophie's question is, have any practices emerged in the US to protect rights while managing COVID-19? So I guess maybe for you, Vinny, in Ireland, the inspector is still in regular contact with each prison on how prisoners are being managed at this time, and going into the prisons to ensure that minimum exercise is being facilitated. So Vinny, would you like to respond to Sophie's question?
Yeah, Sophie, there are literally thousands of entities that run prisons, jails, and juvenile facilities in the US. So there's no centralized answer to that. Some of the places have, some of the correctional systems, our correctional systems are really not known for their transparency. So some of the correctional systems have really clamped up. I fled Brooklyn, where I live, when the pandemic started, to Lake Placid, where I have a house. It's way upstate New York in the Adirondack Mountains. And many US states put their prison systems in such rural areas because there's a lot of cheap labor and cheap land. So as it happens, there's about 4 prisons around here. And there was a recent North Country Public Radio story on that described how county health executives in rural communities like this don't know how many cases of COVID there are in their counties because the prisons won't tell them. They won't tell them how many people have tested positive. They won't even tell them if they're testing. So if you're trying to, sort of prepare your hospital beds, you don't know if you're going to have nobody or hundreds of people coming out of the prison to fill those hospital beds. So I guess my sad answer is no, but that doesn't mean that there's not a lot of good examples too. It's just like I said, there are thousands of examples to choose from, and there's no comprehensive look at that. So the Board of Corrections in New York City, I think, is a very good example. They are publishing data all the time. They are on top of, and that's an oversight body over the Department of Corrections. They have public hearings. They give voice to people who are incarcerated and their families. They give voice to healthcare professionals who are working in the systems. And so that's a good example of a vibrant process. Still a terrible jail, but it's a vibrant process to have this discussion and they're pumping out some of the best data I've seen. But it's a real crapshoot.
Thanks very much. Again, I don't know if Rosemary or Roseanne, but we've got a question I think the whole panel might like to attempt. It's from Giovanna, who's in Dublin via Sao Paulo. So Giovanna's question is, I'd like to hear the panelists' experiences with the media and or policymakers around these issues. Have they been approached or tried themselves to approach the media and policymakers? How did that interaction go? Roseanne, can we start with you and we'll sort of work across the panel? Presumably you've been working closely with the Department of Health, but tell us about your experience and also with the media.
Okay, well, I'd start with the media if I could, because I think it's general for the three presentations. The media is a difficult one. The use of language has been poor by the media generally. They've referred to elders, the elderly, cocooning. I mean, that's a policy term, but I mean, where did that come from and what does it mean? It's so patronizing. That recently, when some of the restrictions were lifted, I heard multiple media reports of letting them out, allowing them to go out for 1 hour a day, etc. So the language that's being used is just not appropriate with respect to the media, and it's a hard one to call. We have tried to call it. I did an opinion piece with respect to that, etc. And really just reflecting on the positivity of older people, the contribution they make to society, because the assumption by the media is that this is a dependent cohort. The very use of the language implies vulnerable and dependent. And that isn't actually the case. 65% of disposable income is held by those over the age of 65. It's the very same in the USA. The contribution that's made to volunteering, without which many of our infrastructures are not viable, is the vast majority are by people contributed to by people who are older. So we have certainly highlighted the contribution that people make to society and the language that is being used by the media.
Thanks, Roseanne. Obviously, we lost you earlier. Just going back to those earlier questions, was there anything else that you'd been wanting to say?
I think I covered what I wanted to say with respect to aging in place being something that we must aspire to, and that it's important that solutions are aligned with economics, because otherwise we will get nowhere. But there's very good evidence that aging in place is aligned to economic solutions and chimes with economics. And the other thing was education and training. Particularly within all infrastructures in our third level institutions is really important.
I want to come back to that in a minute. There's a nice question about that. Rosemary, can we turn to you on the media and policy question?
On the policy front, I think what's really interesting about what's happening in conversations amongst international lawyers are coming back to the fact that the international framework wasn't really prepared, as was not the domestic. It's not surprising, but that international treaties just haven't addressed the whole myriad of issues that have come up. But I think for academics, what's really important is that many of the issues surrounding marginalization and what's required, there's very good research out there. And so it's really about finding the strategic spaces to get that research in the hands of people working in those areas. Much easier in the European Union because you have established channels. The last point that I'll make, and I think one that's really quite serious that you're seeing in different parts of the world, is the way in which freedom of expression is being pitted against public health and public order, so that you have whistleblowers, and we saw that in China in the very early days, whistleblowers being penalized for critiquing public policy. For academics that are in the business of critiquing public policy, it's something that should be really flagged as inhibiting improvements in policy. And at the same time, really important to counter and regulate fake news. So it's a tension that's out there, but something that I think needs to remain on people's radars.
Thanks. Can I ask you to respond to that?
Me?
Yeah, please. The policy, I don't know the extent to which you've been involved in advising your government and your interaction with the media.
Yeah, so two things. The media, if you went back 10 or 20 years on prisons and crime in the US, the media was the enemy. They were hyping up crime, blowing it way out of proportion, and really, I think, part and parcel of driving some pretty terrible public policy, and they will be vilified by history for it. I believe they right along with pandering politicians. That's changed in the United States. The frame around corrections and public safety issues has morphed to one where mass incarceration is viewed as problematic. Not everywhere, not universally, certainly, but I would say arguably that's the dominant media frame about incarceration in the States, and the COVID virus fit right into that. So I've done a lot of media interviews. We've pitched stories to the media. We organized the sign-on letter I talked about earlier that probation and parole folks signed on to. We organized one that youth correctional administrators signed on to, and the media covered that. They've covered stories about incarceration. So that's been terrific. I think that's helped to some degree, allowing people to use their discretion, like governors to release people early or juvenile justice administrators or things like that. I don't think we've seen yet policy changes. It's just been too quick. And the fear of crime for politicians, that they don't want to have another sort of Willie Horton where they release somebody and it goes badly. That's not going to die easily in their heart of hearts. So it's going to take some time. I think this may end up, one of the few benefits of this was it may end up forcing us to re-examine things. My hope is in the probation and parole sphere, we can do that more readily, because I don't think they really understand how many people are on it or how many people get violated now. So they might be a little more willing to shed some of that. But we really haven't seen policy changes yet, despite some pretty good media coverage.
Thanks very much, Vinny. I'm going to see if we can involve somebody in our Zoom room who is part of our GHI. So Brooks Vetz is a graduate student at Columbia, and she has a question that she's asked, and I can read it out, Brooks, but it would be lovely if you actually asked your own question. You've said some very nice things about the panel, so thank you for that. Brooks, are you there? Can you ask your own question?
Hi. Can you hear me?
Yes.
You can. Okay, excellent. Sure. I first thank you all for a fantastic panel. I have a question for Professor Byrne. You spoke about the new meanings that the word solidarity has taken on in this pandemic. And in addition to these new connotations, do you anticipate a different vocabulary, a different lexicon in general for human rights emerging from this time? And I was also just wondering, in general, what terms and concepts you think are best suited for analyzing and for confronting this crisis. Thank you all so much. This was really stimulating.
Thank you very much, Brooks. Rosemary, over to you.
Hi, Brooks. Your question is exactly what I've been thinking about over the past couple of days. And I think in a way that we'll end up putting a greater place on economic and social rights because of issues around health end up having implications for privileged and marginalized communities when you think about the virus as the linking factor. So while it's depressing to think that it's that aspect that has to motivate how we think about solidarity, I think my thinking at the moment is that actually it may have implications in terms of giving a greater primacy to economic, social, and cultural rights that have always been the lesser sibling in the international human rights world. And I think solidarity I think will always be a peripheral value because of the divided world that we live in. So it may not be that solidarity as a norm comes to have powerful impact, but the reality is that we begin to take actions based on interconnectedness might actually become part of the sort of ethos of governments when they're thinking about these sort of operational issues in combating the virus.
Thanks, Rosemary. There's another question for you, primarily from Donna Lyons. And again, I know, Donna, you're in the Zoom room. Why don't you ask your question to Rosemary yourself? But again, the others should feel free to come in. But Donna, please go ahead.
Hi, thanks so much, Jane, and to all the speakers. Hi, Rosemary. It was just really interesting to hear what you were saying about solidarity. We just see so much of this in the media at the moment and in academic commentaries around, will there be a big shift towards solidarity in order to prioritise socioeconomic rights? And I think you basically just answered that question in relation to what Brooks was asking. So my question had been, how do you feel that the human rights movement might change the course of protection of socioeconomic rights, and how might the narrative and the terminology around that change? So I think you have answered the question, but if you had anything else to add, that'd be fantastic. But I really enjoyed all of the speakers, so thanks so much.
Thank you. All that I can really say about solidarity is, I mean, in a way, I'm kind of cautious because our most recent experience is the European refugee crisis, and we all saw how solidarity played out in that context. So what I think is, rather than sort of a major macro reform, what we'll see are promising signs in different sectors that really need to be addressed, but not necessarily motivated by the best intentions.
Very much, Rosemary. Please go ahead, Roseanne.
Yeah. Just a slightly different take on solidarity in the context of what we were talking about earlier on with respect to ageism is the import now of intergenerational solidarity. And with respect to some of the media reporting, there have been instances, many instances, in which almost youth is being pitched against older cohorts as you know, as problems and solutions. And I came across an article by the assistant editor in the Telegraph in the UK, if I may, Jane, it highlights this very well, Jeremy Warner, where he was talking about the economic impact of COVID, and he said, not to put too fine a point on it, COVID-19 might even be mildly beneficial to the economy by culling elderly dependence. And we have had a number of economists in Ireland and the US speaking to freeing up the labour market by enabling younger people to get back into work, etc., as though other citizens don't make a valuable contribution to the labour market as well. So I think we need to really try to ensure intergenerational solidarity in this climate of the pandemic.
Thank you for that hugely important point, Roseanne. You've actually got another question from Sarah Meehan O'Callaghan, who's joining us on Facebook. She says, does Roseanne think there was a deliberate obfuscation in the language from government regarding cocooning and the advice that appeared to be mandatory when older people felt under house arrest? I don't know if you, I think you do have views on that.
Well, I do. And first of all, I'd like to say that they were recommendations. There was nothing mandatory. But it rapidly translated again through the media, so it's very difficult to know, into you must stay in, you must not go out, etc. And I felt that particularly that cohort are generally speaking very law-abiding, you know, and I was on the phone to patients and others who I really felt needed the physical activity of walking to keep them mobilizing, and recommending that they went out with face masks, etc. And there's absolutely no question in their words that I would break the law, or that I would breach the recommendations by policymakers. So I don't really believe it was deliberate. I really believe this hit us. We were not prepared. that was a problem. We should have been, because there were early warning signs, but it wasn't taken seriously. Was there a deliberacy with respect to the nursing home policy of not documenting COVID deaths, etc., in terms of numbers and figures? And well, I don't know, and only time will tell. But I think we mustn't be afraid to question what's happened. And our policymakers must not be afraid of that. The only way we're going to learn from this and get it right the next time is to really scrutinize what happened. No point in apportioning blame, but to learn from what were clearly mistakes that were made, and to take those learning experiences forward.
Thanks, Roseanne. Vinny, can I just ask you, obviously you're here to talk about prisons and not necessarily about what's going on in the US vis-a-vis older people, but have you any reflections on what you've heard Roseanne saying in an Irish context and what's playing out in New York and in the US?
You know, as Roseanne was talking, what I was thinking about was the elderly folks that are in prison, you know, the older prisoners who are the least likely to reoffend. You know, just statistically speaking, they're in the US, it's 30, 40-year sentences are not at all uncommon. So many of these folks came in as teenagers. Michael Tyson's a good example. He was 18 when he got locked up, and he was on parole at the age of 53 when he died in Rikers Island. And that, again, is, as I said about all of this before, that was preposterous public policy even before this. And now it's just deadly and preposterous public policy. There are folks in prisons. The governor has said he's going to release, Governor Cuomo, who's, you know, being viewed by some as handling this well. He said he'll be releasing some non-violent elderly prisoners, which means like all these people like Michael Tyson, who when they were 18 and committed their violent crime, won't be eligible. And that's most of the older prisoners we have. Those folks should be out. They should be out right now. We shouldn't be. Some people, we need to be very careful about who we release. I frankly don't think that's the population we need to be very careful about who we release. If you're over a certain point, go. So that, first of all, you don't get sick and die. And second of all, that there's room so that inside, as staff start getting sick, which they do, or staff start getting afraid, which they are, and calling in sick, whether they're sick or not, or staff's wife or husband or kids get sick, they're going to stop going to prison. And the next thing that happens, and is happening, is they start locking everybody down because there's not enough staff to guard them. So fewer people incarcerated is really important, not just for an individualistic examination, but just because we need to spread this staffing and prison facilities out amongst a smaller group of people, because when the pandemic hits, it's too late. If the head of health at Rikers Island said a storm is coming, and it hit Rikers first, so he was warning all of his colleagues. Well, if a hurricane's coming in your direction, you don't wait until there are 100-mile-an-hour winds to get the hammer and nails and boards out to board up the windows. You do it before the storm hits. Too many people are sitting and hoping that it never hits. What should be happening right now is all of those elderly prisoners, we should start moving them out. All technical violators, they should be nowhere near our prisons and jails. They shouldn't have been before, but they especially shouldn't be now. Anybody that's got 90 to 120 days left, nothing good is going to happen in the next 90 to 120 days that's going to turn this person into something different than they were. Get them out of your places so that you are as ready as you can be in a compromised environment with a compromised population when the virus, not if, but when the virus hits you. And older prisoners are subject number one in that conversation.
Thanks very much, Vinny. We can turn now to the role of the universities. There's a question from somebody who's in the Zoom room. So, Aideen Nishi, do you want to go ahead and ask your question? Or I can ask it for you. Are you still with us? Aideen? Okay, I'll ask it. The question is, what is the role of the universities in sparking these responses? How do we shift our programs to support creative and interdisciplinary action? And I think that is a question actually for all three of our speakers. The role of the university. I know you touched on it, Roseanne, earlier, but maybe if we start with you and think about what we in the universities can and should be doing to respond.
I think the university sector has been remarkable in repurposing a lot of what it was doing in response to the COVID crisis, actually. There's a lot of good evidence globally with respect to that. In many ways, that's kind of the sexy bit of all of this, you know. It was dramatic, it was adrenaline rush, you know, and so, but the universities have been very good in that context. So that's the immediate response. In the longer term, I think that from my perspective, as well as the biological sciences research and immunology research, which will go into vaccination development and also different biomarker tests, etc. It's generally speaking, in the context of marginalized cohorts, awareness of aging I can't think of a discipline it's not pertinent to, even pediatrics, because we start to age in the womb. So part of what we did in Sapia was the life course approach to aging. So I actually cannot think of any discipline that it's not pertinent to, but our institutions are quite ageist. And when you try and broach this, you get very pleasant smiles, but there's very little action. So I would call an action call for action on introducing an understanding of the aging process in each of our faculties.
Yeah, well, obviously we would welcome that, Roseanne, and it's great to hear you say that. Rosemary, from your perspective, what role do you feel the universities have to play here? We can't hear you.
I think Great. The universities have gotten much better at looking at issues of impact, of kind of steering colleagues to be able to access policy channels, particularly in the European level, which is the zone that I know best, the extent to which the European Commission has really fostered these links. But I think networks really matter, and I think networks with policymakers matter. The problem is that the academy in many ways hasn't valued the interaction with academics. It's usually what you do beyond what is recognized within academia in the policy community on the ground. But if you want your research to be relevant, if you want to be able to have real-time evidence that's going to speak to what's on hand, you actually have to know what people are thinking. You have to know what's happening, whether it be in the prisons, whether it be in refugee centers, whether it be within the kind of bureaucracies of policy-making processes. And if you're not tuned into that, you may have very good research, but you're not really connecting in, or the likelihood that you're going to be able to connect into the thought processes that will genuinely influence change and transformation is very low. So I think that's something that particularly young scholars really need to work with. How do they keep their foot out in the field so that they're actually, very connected to the kinds of issues, and they're picking up how things change? I mean, the one thing that really strikes me in the area of human rights is no matter what you're working on, whenever you start talking to people who are doing it day in and day out, and not the senior people, like the people on the ground, you discover how you're always off a little bit. There's always something that you thought was major, and actually it's something really quite minor and technocratic that is a real obstacle. But unless you really have that kind of engagement, the likelihood that you're actually going to have an impact diminishes. So I think that's really important. And I really think that the turn towards the real power that academics have is the respect that's paid to evidence. And that is one thing that we do very well. But I think we need to work on this kind of the linkages between policy, and I think also the way in which universities value those linkages and the people that are engaged in them also needs to change a bit, because the incentive structure needs to actually encourage rather than discourage that.
That incentive structure is so important as well, though. And again, I think maybe the silver lining in this crisis is that we will change those behaviors within our institutions. One lives in hope, but that again is for us to be lobbying for that very hard. Vinny, can I ask you, obviously you're very proactive, but in terms of, Colombia, how do you feel that the university has responded? What could you do more of? Any just whatever thoughts you have on this.
Yeah, Columbia dove in. I was pretty proud of the university's response to this, and not just in criminal justice, sort of across the board. The School of Public Health and medical school, law school, people were very, very active in terms of holding forums, of synthesizing research. The governor was very reliant on Columbia experts in conversations about what policies he should take. Unfortunately, not in the criminal justice sphere. 120 of us signed a letter to Governor Cuomo urging him to release older prisoners, to do early discharges for people that were close to the end of their sentences, to stop locking up technical violators. And we got no response to that. But we were in the game, at least, on it. And I think that as we think of education for the next semester, next year, next couple of years, we have to figure out how we're going to incorporate the marginalized populations in COVID into all of that. This is not affecting all people equally, as my co-panelists have mentioned, and we need to, I think, as a academic institution, both Columbia and in general, start to emphasize that, because power structures don't really have a glimpse into that unless somebody figures out a way to put it in their face. Sometimes that's advocates, sometimes that's people who themselves are part of that world, if you will, prisoners or prisoners' families. But sometimes it's us. Sometimes we in academia have to step up to the plate and make sure our policymakers understand what's going on with marginalized populations, or at least do our share.
That might be your mobile phone going off. There's somebody's got mobile.
Yeah, I turned it off. Sorry
You're
about
a man in demand. Thank you very much. I'd love to go back to the Zoom room. Sahar Ahmed, who is a colleague in the Trinity Long Room Hub, one of our early career researchers. Sahar, you've got a great question. Why don't you go ahead? I'd love to hear from you.
Thanks so much. Hi, this is for Professor Byrne, actually. And thank you so much for all your wonderful talks. They've been really, really insightful. Professor Byrne, I was wondering what you think about the huge crisis of migrant laborers as it's happening at the moment, particularly the way it's happening in India, especially in the last couple of days. A lot of southern states in India have basically effectively are holding migrant laborers captive with closing down trains, etc. And I mean, you're in the Gulf at the moment, so the Gulf states have also had a history of being quite guilty of exploiting poor and brown migrant labor as well. And I just think what you think how this fits into the narrative and the conversation of human rights, because somehow, particularly how we in Western academia talk about migrants, it almost either means migrants coming to the West or refugees in camps. And how do you think this particularly marginalized and vulnerable group is going to become a part of the conversation, particularly after COVID? Thank you.
So to understand your question, are you talking about internal migration?
Internal, but also external. Particularly the kinds of internal migration that is happening within countries like India also tends to happen externally to countries in the Gulf. So.
Yeah, exactly. Okay, I think I understand the scope of your question. I mean, I think what's interesting and really disturbing about the Indian context is the extent to which the scale of it is just really staggering. But I notice that there's been this very recent letter, which I've read of, but haven't seen the direct text, of over 100 former civil servants really speaking out on the necessity of providing various forms of protection for these migrants that are having trouble passing internal borders, for receiving, adequate protection within shelters and access to healthcare and subsistence, etc. So I think really what the internal migration is showing us is the extent to which we were unprepared for the pandemic, and that actually what is really required is for new structures, protection structures, to be put in place. And what you're seeing in the Gulf, and I think what you're not seeing in a visible level, but what is happening in some instances, I mentioned the Bahrain legislation, where you actually see action being taken. And the other area where you begin to see, and again, they're minor changes, but they're not visible, would be, say, for instance, corporations, when they're entering into contracts with suppliers, are now adding additional guidelines in terms of what their expectations are for protections in housing, for instance, space and sanitation standards. So I think what's difficult right now is it's all happening very quickly, so everything is reactive, but also we can't really see everything that's happening. But I think migration and protecting migrants has always been an area where the world, not only individual nations, falls woefully short in terms of really protecting these people at the margins. And I think one thing we can look that COVID may improve things, but I think actually because of borders and the fears that come with it, I would say that migrants are particularly vulnerable in this, and particularly refugees, where you're seeing that borders are being completely closed. So those that are fleeing from war, persecution, are really not only at the margins, but being completely excluded from the framework of protection. So it's a rather grim answer, but I think there's just a lot at stake here, and it's not really clear how things will evolve.
Thank you very much, Rosemary. And I'm failing miserably. I've just realized the time. We've already gone over slightly, and partly because it's such a fascinating conversation and the questions have been fantastic. So I am going to have to wrap things up, and I'm sorry that we don't have time to take the rest of the questions. Before we thank our three fabulous speakers, we would love you to complete a survey. I realize everybody gets sick of doing surveys, but we'll share one immediately after this. It's short. It's just to give us some feedback on how this afternoon has been for you. Just take a couple of minutes. Also, I'd love to invite everybody to our workshop next week, which is on inequality. And it was nice to end actually on that note, Rosemary, because that's exactly where we'll be picking up the conversation next week. It'll be Wednesday, the 13th of May at 4:30 Irish time, 11:30 at New York time. And we've got, again, three fabulous speakers. Colm Tóibín, who's, of course, a professor at Columbia, but who is also a national treasure in Ireland, a phenomenal writer. Seamus Khan, who's professor of sociology at Columbia, who's been very instrumental in actually helping set up this series. And Sucheta Mahajan from JNU University in Delhi. So we'll actually be coming very much back to this conversation about India. So that's on inequality next week. All of these details, of course, are on the Heyman website, the Hub website. Please register. There's lots of other amazing events going on, both in Trinity and in the Heyman, but given I've overrun already, I'm not going to do big long plugs for those. But I really would encourage you to check out both websites, because we have just a whole series of fascinating events that are very much responding to the COVID-19 crisis. And obviously, it's fantastic when you can join us for those. I'd like to thank you all for joining us this afternoon. The questions have been fantastic, and the conversation has been remarkably fluid, given that we're doing it all virtually. But of course, these discussions are made by having such amazing panelists. So on all of your behalf, I'd like to thank you, our audience, to thank the team that makes these events run so smoothly, especially Francesca, Aoife, and Ellie. But above all, I'd like to thank Vinny, Rosemary, and Roseanne for just three absolutely cracking presentations. So if we can do that in a customary way, give them all a roaring So thank you, everybody, and stay well. Bye.